Assalamu alaikum. In this video, we are going to discuss about the morphology of Phyllodes tumor of breast mainly, and it is a benign tumor of breast, and it is mainly intralobular stromas tumor. I have told you before in the previous video fibroadenoma that what intralobular stroma means, and its counterpart interlobular stroma. I have explained it before as well. You can see from that video if you want to know this basic difference of intralobular stroma and interlobular stroma. Okay, so Phyllodes tumor, actually this is a rare tumor of the breast as compared to fibroadenoma, which was a very common, rather it was a commonest tumor of breast in adolescents or young women. Okay, so let's start with its gross morphology. Here you can see that somewhat areas of hemorrhage and necrosis can be seen, and this tumor is basically somewhat round to oval in appearance, and it is also bosselated. Bosselated, what bosselated means? Actually, you know that what a lobule means. Lobule means somewhat like this appearance, but bosselated means somewhat an appearance where protuberances can be seen easily, like this. Okay, like here, but here is another protuberance. Here you can easily see protuberances here. So this tumor is also less fully encapsulated as compared to its counterpart fibroadenoma, which was a very much well circumscribed tumor, and we may say that that was an encapsulated or fully encapsulated tumor as well. And this tumor is large, and if this tumor is mainly of 10 to 15 centimeter in diameter. And sometimes it also involves the whole breast, like here you can see that fungating Phyllodes tumor can be seen easily here, that it is involving almost the whole breast, right? Now let's move towards its mm, microscopic features, but before that I want to mention here that on cut surface of this tumor, when we take a cut section of the Phyllodes tumor, there are somewhat cystic areas can also be seen, and this tumor is also great white in appearance, just like that fibroadenoma, which was also great white in appearance. But when we take the cut section of that fibroadenoma, there are actually somewhat bulging nodules appear, or we can say that their slit-like spaces can also be seen, but here no such structures can be seen. Let's move towards just microscopic features. In actually microscopic features, this tumor just looks like a leaf. Phyllodes actually means, or we can say that its wordly meaning is a leaf. Okay, here a leaf is seen. It is ridiculous that I'm showing you here a leaf, but this tumor actually resembles just a leaf. That is why it has been named Phyllodes. Here you can see that uh, here mainly stromal hypercellularity is very much prominent, like here you can see that stroma is hypercellular here, and this is epithelial component. Stroma is growing so much faster. This stroma is growing towards this epithelial component, so that here somewhat leafy appearance has been appeared. Again, it is actually this, in this picture there is somewhat magnified view of this one, like if we can say that a small cut section or a magnified view of this portion is taken, as in auspice we are very much worried as well as hurried. Okay, so we usually don't pay attention that it can this slide can also be a Phyllodes tumor. We might ignore it, so you must keep it in your mind that Phyllodes tumor slide can also be like this. Somewhat magnified view. Here you can see somewhat leaf-like appearance. If we take the magnified view of that previous slide, here stromal hypercellularity can be seen, and it is going towards the epithelium, just like this, that a leaf can be formed. This is histological appearance. I hope so that I have explained it much. Again, here you can see that somewhat leafy appearance. Okay. Again, somewhat leaf-like appearance can be seen easily here. So that was all about Phyllodes tumor. I am again repeating here what I have mentioned. It's microscopy. Actually, her stromal hypercellularity can be seen, and this tumor is also a biphasic tumor. As I have mentioned before, the fibroadenoma is a biphasic tumor where there were two types of proliferations. One was fibrous component, and the other one was stromal component. In the same way, this tumor is also biphasic tumor. In microscopic features, one feature is that here stromal hypercellularity is very much prominent. Number two is that a stromal component grows in such a manner just like a leaf. Number third is that As let me open it again. Like here, this is a picture of your big robins, and here stroma proliferates in such a manner that it can form somewhat bulbous protrusions, right? And then after treatment of this tumor, in about 0.3% of women, angiosarcoma develops mainly after radiotherapy, and it develops almost 5 to 10 years after the treatment. Or we can say that it is mainly diagnosed 5 to 10 years after the treatment. And this tumor is actually a morphological continuum of benign to malignant. Okay, what it means that it is a morphological continuum from benign to malignant, it means that this tumor can either be a benign tumor, it can either be a borderline tumor, it can either be a malignant tumor, right? So its malignant counterpart can be seen as just like a liposarcoma or rhabdomyosarcoma looks like. I hope so that this will be clear to you people. If you want to know the basic difference of fibroadenoma, you have to watch my previous video. Thank you very much.